Yeah, it's your village girl, Dr. Dakalo Ndouvhada, and this is the Doctor's Corner podcast. And today with me, I have the most amazing Dr. Julia Sakman. She's a medical doctor, she's a mom, she's a woman of many hats. Dr. Julia, welcome to the podcast.
Thank you, Dr. D, and thank you everyone for having me. I'm so honored to be invited to your podcast.
We're really excited to have you here. Me personally, I'm really excited. Dr. Julia, I said you're a woman of many words. Obviously, we've had conversations before this. Dr. Julia, please introduce yourself. I already know who you are, but tell everyone what you do, what you're about, because people want to know, who is this girl?
So I'm Dr. Julia Sakman. So you did say it right. Oh. I'm a mom to two beautiful girls, aged 4 and 2. I'm also a medical doctor. I just recently completed my ComServe. And then I'm also a content creator. And recently, I've also started my own telemedicine practice. So that's basically all the hats that I wear.
Those are a lot of heads. And as doctors, I personally am used to like traditional medicine. You work at the hospital, or you're a GP, or you're a specialist working in a private hospital. This thing of telemedicine, when you go on Google, I mean, now when we Google on TikTok, if you go and say telemedicine, the first person I saw was Dr. Julia. I'm like, what is telemedicine? What is this girl doing? Can you please tell us more about telemedicine? How did you get into it? What do you need to do telemedicine? And are you really seeing patients? Who are you seeing?
Yes. So telemedicine is just like the many things I do. I would say I am learning as I am doing it.
You're learning on the job.
Yes, I'm learning everything on the job. It's quite new in South Africa. It's not a very common thing for people to do. And I also got introduced to it by a colleague. I didn't pay attention to it until I got to a point where I needed it. And I think when my ComServe contract ended, and I had to sit at home and think about my life. And there wasn't a next thing to go on to. I was looking for something that was very authentic to who I am and what I do. And because I create content, I've been trying to find something that I can monetize my content with.
Yes.
So I guess I just thought about it and I asked my followers, are you guys interested in me doing online consults with you? And people said yes. And I think the rest is history. Then I just got into it. And then going back to your question on what it really is. So how I look at telemedicine is us as doctors have a lot of skills, a lot of expertise that we have from our degree, from our experience working in the hospital. And we never think of how we can actually monetize those skills. Yes. So how I approach it is I offer my expertise to my patients. And then there's obviously a limit to it on what I can do. I can't do everything as I am not seeing my patients in person. Basically, they book a consultation with me. We do online consults and it's mostly reliant on the history that the patient gives me. Yes. And then if I pick up that the patient needs to be examined, I will obviously refer the patient to the physical facility to be seen. But most patients I've seen, I actually manage to manage the whole patient on my telemedicine platform.
So what is a governing body of telemedicine? Is there someone who's watching if you're doing the right things and if things are legal, right? And if there's anything legal that HPCC needs to approve, what is that? What do you need insurance? Because you're giving people advice. If you give someone advice and then they say you did whatever that you didn't do. How do you cover yourself with that? How do you, because I asked this question because I'm a GP, right? I see patients the same way I would see patients in the government, right? I see a patient, she gives me history. I examine the patient. There's vitals involved, right? Because all those things make a diagnosis, right? So now I can only imagine you have this patient says, oh, I have this and this and that. You ask thorough history and you need to confirm, maybe you have 5 different diagnoses. You need to confirm with your examination what it is. I'm guessing it's quite difficult. I also am looking, I'm like, okay, can I do that? I don't know. So what are the legalities around it?
So telemedicine is governed by the HPCSA as the whole medical field is in South Africa.
Yes.
So it is legal for us to practice telemedicine, but only under certain guidelines that are set out by the HPCSA.
Yeah.
Yes. So there are limitations on which patients can be seen in a telemedicine practice and how far you can go with prescribing medication to patients. So I've been following those guidelines that are on the HPCSA platform. And I guess with telemedicine, patients also, they know when they have an emergency. Like I've never been approached by a patient who was really sick and needed examination and needed, emergency help. Most of the patients that approached me are patients that needed advice on certain things, that needed repeat scripts on certain conditions. And obviously, as a doctor, I always need to use my discernment and I always need to follow the rules that I've always followed, even as a physical doctor in a hospital.
Yes.
So I need to always remember, what are my limitations? When do I need to refer a patient? If I speak to you and you tell me you have abdominal pain, I can't touch your abdomen and see how bad it is. So those patients, I would advise to go to the nearest. Yes. And also because I see some patients who are mental health users, healthcare users. I also do the interview. And then I pick up if there's any risks
to self.
Risks to self-harm, risk to others. Is there any reason that this patient would need to be in a facility?
Yes.
Then I need to stick to that and refer the patient appropriately.
Yes.
So when I got into it, I was also scared because I was like, what am I going to do?
Yes.
But as I am on the job, I can see that it's actually not that difficult to navigate because if you use the same skills you had as a doctor in a hospital, you can always triage a patient and pick up that this is an emergency, this is not an emergency. Do you understand?
Yes. Okay.
So, I don't know if I answered the whole question.
No, you did. So my thing is, I am a GP, right? What I needed to have money to start a GP practice. I needed to register with the for practice number. I needed to have insurance, right? So when you do telemedicine, obviously you need a practice number to be able to write scripts and to be able to practice as an independent practitioner, right? So you're doing it at the comfort of your home. You don't actually, you can do it on a couch, right? So did you have to set up a whole office? Did you need to save a lot of money? Did you need a website? And if you did need a website, how did you go about it? Or if you don't have a website, what platforms are you using? Because it should be something that it's easily accessible to the patients. And does it comply with POPI Act? How are you going about that situation?
So what I've said to a lot of people who ask me about telemedicine is that the best thing about telemedicine is that you don't actually need startup money.
Capital.
Yes, you don't need capital to get your business going. But I think what helped me get going quite quicker was the fact that I already had an online presence. So I already had patients waiting for me to consult.
Yes.
So which meant I didn't have to spend on marketing because I marketed myself to my patients. Yes. So what I spent on was my practice number and then also with insurance. So you need insurance, of course, because there's no hospital that's covering you right now.
Yes.
Yeah. So I spent on the insurance and the practice number. With regards to the office, I don't need an office. I'm doing everything at the comfort of my own home. But the important thing is that I need to treat my patients confidentially.
Yes.
So I need a room in my house where I can close the door and speak to a patient.
Yeah.
Yes. So that is what I'm privileged with having an extra spare room in my house, which I've now turned into my telemedicine office.
Yeah.
Yes. Okay. So that's what I'm doing basically. So no rent.
So I'm like, you already had like a platform.
Yes.
That your marketing is easier. People already know who Dr. Julia is. People already are asking you questions, right? So for someone who's out there, they might have to spend on advertising and all those things. So with regards to patients, you did mention mental health.
Yeah.
What other conditions do you see mostly, or what kind of patients do you see on a daily basis?
Okay, so I've been running my practice for I think just about 3 weeks now. So it hasn't been long.
Yes,
but with the experience that I have with the patients that I've seen currently, I see a lot of moms come to me to ask for advice for weight loss, asking for options. Do they have any other options? If they've been struggling with gym, with eating, are there medical options that are safe for them to embark on? I've been helping postpartum moms take care of their mental health, take care of their babies, because, as a new mom, there's just everything new that is going
crying,
on.
You feel like it's a problem. I'm also crying with the baby. She sleeps too much. She doesn't sleep.
Yes.
Yeah.
So I found myself supporting a lot of new moms with regards to giving them advice, with regards to easing their minds. To just understand and be educated on what happens postpartum, what happens to newborns, what's normal, what's not normal. And sometimes if I need to prescribe something, I've helped them.
Yes.
And I've felt like they also love that they are able to get hold of a doctor in the comfort of their own home.
Yeah.
Because they just had their baby like 2 days ago. They don't feel like going out. So they've also appreciated the service. I think something else, I've also helped people with contraceptives.
Okay.
And that's pretty much it. And I mentioned mental health as well.
So I'm guessing is for me, from a doctor's perspective, I'm guessing it's very difficult to see a patient that's risk to self, and you are like, okay, you need to be taken by an ambulance. You need to go to the hospital. They need to like sedate you. How do you get you're like, okay, you said you want to kill yourself. Okay, you need someone. Is there anyone in your home? Can I speak to someone else? Have you ever gotten yourself into that position?
Not yet, but I have thought about it. But it's more a thing of the previous patient I've seen was a patient who was struggling with mental health. So I asked her if I could speak to family and find if there's someone who can help her get to the hospital, but she wasn't a risk to herself. I just needed a second opinion from the family, because you always need collateral.
Yes,
a patient will tell you, I don't want to kill myself, or I'm okay, I'm not talking to myself. But there's always that option of, I can speak to collateral and I can ask collateral to take the patient to the hospital. So it's been that, but I've never had to deal with like a patient who's a risk to themselves at that moment. Yeah.
Okay. So, and then another thing as a doctor, I think having a community, a network of other doctors to refer to, it's very important because you are doing it here. You want someone else to examine. So you need to form relationships, right? And I just realized, girl, I think I've been doing telemedicine, but for free.
Yeah.
Because like today, someone calls me and say, oh, I have this issue. What do I do? Instantly, because I'm used to just helping people for free. I don't know the business part that I can monetize, just as someone asking me that. And my cousin told me this morning, she's like, my sister, that's a critical skill that you have. And it doesn't go, you don't just
know how to manage these things.
Like she gave an example with herself. She said, I don't go and be coding for, she said, you don't just ask me, okay, do this website and I just come and do it for free. The same thing as you. You don't just give advice for free just like that, especially because you're in private practice. You need to monetize it. And I was like, but she's just asking. Yes, we come to the doctors because we want to ask, So it's important that you teaching us, people like me and someone else who is doing community service, doesn't have money to start a big practice, they don't even know what direction to go. We know the state that we're in South Africa, doctors are not being employed. Not that doctors are not needed. Don't get that wrong. Doctors are needed because the doctors in the hospital are suffering, understaffed and overworked, right? Yet we are here available to work.
Yes.
So during this time of telemedicine, have anyone ever taken a chance? Because people are chance takers, especially when it comes to like sick notes.
Yes.
Inappropriate
every day.
So how do you deal with that?
So I'm very professional when it comes to my practice because I never want anyone to view me as an unprofessional doctor or to think they can take advantage of the fact that it's online. Especially because this is such a new thing. Obviously, there's already a lot of criticism on how it works, on the legalities of everything. So whenever someone is like, hi, I didn't go to work for the past 3 days, can I get a script? I have a very formal, professional reply. Like, I'm sorry, I don't sell sick notes.
Sick notes,
yes. So I'm a doctor. I offer consultations for sick patients. If you're sick, you can talk to me. Then we'll decide if you need a sick note.
A sick note is like a prescription.
Yeah. So we need to first have a consultation. So I've had chance takers, especially the guys. They don't even want to lie to you. They'll come straight and be
not sick.
Sick note.
Doc, I'm not sick. I just need a sick note. Yesterday I was drinking with the boys. I didn't go to work today.
Askies, especially because you told me. Now I can't even touch you.
Yeah.
Because I don't sell sick notes.
Yes.
So there's that.
It's quite uncomfortable, hey? It's quite uncomfortable, especially family members. Don't ask friends. Don't ask us for sick notes.
It's a very legal document.
If I get arrested now for giving sick notes, you are going to say, yes, we always knew she was not a real doctor, but sick note. Don't do that. Don't do that.
Yeah.
Anyway, so thank you, Dr. Julia. If there's something you can say before we move to the next thing that I want us to talk about, before we can move on, what can you tell the ComServe that's sitting out there and thinking, we are in trouble?
Yeah.
What can you say to that?
Because we are in trouble.
We really are.
We are in trouble. And I feel like when you are looking, like from internship, from ComServe, you don't think it's as real as it actually is.
Yes.
Until you get to it and you realize that, it's real.
We are in trouble.
So I would say biggest advice, please save your money. Save your money because after ComServe, you're going to have to navigate life. And you're going to have to do something for yourself until the government decides to hire you again. So that's the biggest thing. Like, make sure you can continue.
And this is the month, or when we're shooting, this is the month of July.
Yeah.
It's the 7th month of the year out of 12, right? So I have personally my friends who have been unemployed since January. So save your money. You need that peace that at least I can pay my car. At least I can... I can go about life. Yes, I can eat. If you don't have a place to go, at least you can pay your rent, save the money. So of the many hats of being a doctor, now practicing telemedicine, you also mentioned that you're a mom to 2 beautiful girls. And we've seen them on the social media streets. How are you doing? Like, I can imagine you going to work every day and your children going to school, having to come back home, cook, and all those things. How is motherhood with all the hats that you're wearing right now?
So motherhood can never be easy. As much as it looks easy online, but it can never be easy. It comes with its own difficulties. But I think for me, I've always wanted to be a mom. I love medicine. And then I love creating content. So all the things I do are things that I'm very passionate about. I'm passionate about homemaking. I'm passionate about taking care of my family. And I think since med school, I've always worked on how can I try to balance my life to make sure that I'm feeding all my passions. So it's been something I've been deliberately doing. It's not easy. After a long call in the hospital, having to come back home and cook for your kids and play and be present. But I've always deliberately, I do things because I want to do them. And then I think the same goes with content as well. I tell myself that this is something I want to do. These are my goals and I'm going to do it. So I think that has helped me sort of navigate the difficulties that come with it. But like I told you earlier when we spoke about how do I switch from all the roles, what made it easy in the hospital is that I never had to take work home. When I'm in the hospital, I'm there, I'm dying, I'm on call, and then it ends. And then I go home, I get home, I'm fully a mom, I'm with my kids, I'm creating content that is very family-centered. So I get to spend time with my family as I'm creating the content as well. So that's how I've managed to balance everything.
And you know why? You said to me earlier that the people that follow you, you are followed by people who are very positive. It's because the people in the social media streets, they say aura. Your aura, girl. Your aura, girl. You make everyday life look normal. Because we are used to having the same cultures and all those things. You are there just being a mom and working, doing your laundry. I think my favorite part of it is doing your laundry. And my favorite video is when you were cleaning the laundry room. I'm like, this girl's just like, her house is just like mine, bruv. Like, it's not curated. It's not the Instagram-worthy, picture-perfect house. It's just a normal house, you know? And I love that. I love that. And I love the fact that you're doing two things that you love, being a mom, being a homemaker, and you fulfilling the other thing of being a content creator and making an income. That's amazing. For someone who's like, oh, but I'm just a mom, I can't do those things, what advice would you give them?
I always tell people, anything you say you can't do, you automatically can't do. So it's all in your mindset. It's all in your will to do what you want to do. Like I mentioned earlier, if you really want to create the content, you'll make the time to create the content. You know, you'll make the time to edit and post the content. Because with me, I would shoot the content after my long day in casualty. Standing the whole day. Then I get home and I clean my lounge. That's because I want to do it. So I'm not going to make an excuse of saying I'm tired, I'm a doctor. I used to do that before and I was very unfulfilled. And I was like, I want to do so many things, but there's something hindering me, you know? And then once I decided that I actually want to do all these things, then I get to do them. And then I make the time also when my kids go to bed, I edit my videos and I'll post it, you know? So that was like something that I got myself into. And I always tell my followers, a lot of my followers are telling me now that they're better homemakers because if a doctor can do it, then
I also can do it.
But yeah, and I think also just normalizing, touching on the point where you said I make life look normal. I feel like that's also the best thing I've done with my content because I've shown people that doctors are people. Doctors are real people with real homes, with real difficulties. So people don't put us in a pedestal anymore because now there's people who are showing the normal life, you know?
Dr. Julia, do you know, like when I started following you now, it was because of that one video when you were speaking. I mean, it was a lot of them when you're speaking about staying in DQ and you were staying with a full family in a DQ. I asked myself, why did I even move to an apartment? What was the reason? And I think we moved into an apartment because it was the next step. Was it a necessary next step? No. I could have moved now. But then because of, we learn as we go.
Live and we learn.
Yes. So, and another thing, because I started following you from there, so I saw your content a lot. And one of the things, I'm a new mom. My child is only 1 year. So when I started seeing how you are with your children on social media, I'm like, I like her. She makes things look easy, right? So because you wear so many hats, girl, and you're a mom, how are you juggling that? How are you feeling about just being a mom, a working mom? Is it easy? Because for me, it's not.
Hey, it's not been easy. And I think it took me time to make peace with wearing all the hats and working on my mom guilt, because it will always be there. But I think what has made it better is that I've made peace with the fact that in life there's no balance. When I do one thing, I fully focus on what I'm doing, and then I become the best in that moment for what I'm doing, and then I move on to the next one.
Yes.
So I think that outlook on life has really helped me navigate the whole thing mentally.
Yes.
When I'm at work, I'm fully at work. I trust that my kids are taken care of. I've made sure that they're taken care of by people I trust. So then I let them do their job. And then I do my job as best as I can when I'm at work. And then also when I get home, as I mentioned earlier, because I wasn't taking work home, it felt really easy to just be in the moment and fully be a mom and embrace everything that comes with with being a mom when I'm at home. So in that way, I have filled that part of myself.
But now it's different because you work from home.
Yes.
So, and now school holidays. Do you have a nanny?
No.
So when you close the doors and the kids are in the living room, don't you feel, when they say, I mean, you have toddlers, say, mommy, this, mang, wirang. And you're working and you have to say, how does that, how do you?
I think this new journey that I've now embarked on has been different. And obviously I'm still learning now on how to make everything work. It has been difficult. When I started in my first week, the kids were at school. So then there was like a nice, time when I'm at home and I'm working. But right now it's school holidays. The kids are at home. But one thing I will say I'm grateful for is having a very supportive partner. My partner has been supportive since med school because we had our first kid when I was in final year med school. So because we understand which, what can I say? Can I say level of life?
Where you guys are at.
Yes.
The season.
The season, yes, that's what I want to say. Because we understand which season of life we are in, we have found a way to support each other through everything we go through. So right now, what helps me is that he works from home. He's mostly on the computer, so he'll work in the space where he can see the kids. And then I need to be in private because I'm speaking to my patients. So that has sort of helped because I know someone is with them. They can bother someone until he needs to be in a meeting. Then I will switch up and then be with the kids. But it hasn't been easy because they've been watching a lot of TV.
Yes.
I've had to make peace with the fact that this is the season we are in. Things will get better. And sometimes at night when I put them to sleep, I'm like, how are you feeling? Just know that things are going to be better. It's not always going to be like this. But it's seasons. Like I told you, when I'm in one season, then I fully focus on what I need to do. And then I know that the time will come when I manage the practice better and I get to spend more time with them again.
Yeah. So you mentioned a partner.
Yes.
It means that when you right now with regards to parenting, if you are giving 20, your partner is carrying the 80.
Yes.
When you can give 80, your partner will carry the 20, right? So that balance is there. So your community is very supportive. You also said that you did put things in place to make sure that your kids are well taken care of. So that's very important. And then another thing, because I'm a new mom, right? 1 year into this thing, I didn't have any problems. Like earlier on I remember the first year of her being alive, I never had issues. But for some weird reason, like things are starting to surface now. And I'm in a different season of my life. Then when I have the financial muscles to put things in place, like I have a nanny to support me, right? Things were easy. Even like the first few months when my granny was there, when my sister was there, things were easy. My grandmother and my sister still there for me, right? But they had to take my child and parent her in the village. I have a trauma of my mom not being there because she had me when she was younger. So she had to go live life and go study, go meet another partner, you know? So I have that trauma of I want like
to be with your child.
Yes. When I see my child and their cracked cheeks, I'm like, I don't want that. Like I want my child to be well moisturized. I want my child to be well nourished. And bet me, I am the problem because my family, they take care of my child.
Of the baby.
But I want to see the things that I want to see. I think the problem is that I parent me through her. Yeah. So I need to go to therapy for this. But anyways, so with that being said, I don't know, is this postpartum 1 year and I'm facing difficulties when it comes to parenting?
So I would say... So postpartum medically is the time from when you give birth to your baby up to 6 weeks, right? But obviously the motherhood journey doesn't stop. And you as a person, you also don't stop growing. So there's a lot of things that you will see as a mom that will resurface. And I believe that my kids are actually here to help me heal some parts of me because things will always come up and I'll always have to face them because I'm a mom now. I can't let it, you know? So yeah, I think we need to look at it in that way in terms of supporting moms because in the first 6 weeks, it's easy to spot it and say, okay, this mom is having postpartum depression. But what happens to the mom who struggles later on, like you mentioned, you struggle with your own mental conflicts. So I think we also need to look at that part of being a mom. Yes, and support that as well. Yeah.
So, okay, now if we move in the aspect of just being a doctor, you did mention that you do support moms telephonically. They consult talking about whatever that they're experiencing. I'm guessing you see a lot of postpartum things and you have to support them. What are the most common things that moms during postpartum complain about?
The biggest thing I've seen with a few patients that I've seen is moms who don't have support. And those moms are also like struggling with mom guilt because they are not able to be available to their kids the way that they want to. Yes. And then it's very easy for that to now affect your mood, to affect how you interact with your baby. And then it's just like a circle that comes back again. You feel bad about what you're doing, but you keep doing it because you have to do it. You don't have support. So I've seen a lot of those moms that
are struggling
with their mental health. But also what helps is validating what someone is going through. You know, I've seen that it helps a lot to show them that what you're actually going through is not easy. You know, it's not everyone who are going through motherhood the way that you are. So to also be kinder to yourself, to acknowledge that you're actually doing well, you know? Yeah, so I've seen those moms, and then there's moms who are struggling with breastfeeding. And that can also contribute to mental issues.
Because of the pressures.
Yes, there's the pressure of you getting information that if you don't breastfeed your kids, then you're a bad mom.
You're a bad mom.
Yes.
Other people just can't breastfeed. I remember when I was an intern, right? There was a lady, she was in her 40s and she had her first child in her 40s. And she was literally crying tears. She's like, I don't know how to. At that time, I was not a mom. I never thought I would be a mom, guys. And that lady was struggling, I could see. I said, I've seen so many moms doing it here. And I know the book, right? And I had a relationship with the breastfeeding counselor. She taught me all those things. Okay, you need to do this. The patient needs to do this, right? I went to that lady. I carried her daughter. I said, you want to cry? You can cry. She cried, she finished. And then after, I said, you sit nicely, you relax, carry your baby, show her how to breastfeed, not to put pressure on herself physically and also emotionally. She needed support and encouragement. And from that to the days that she was admitted, because her child was not getting milk, she literally improved so well. I met her at a mall. She recognized me. And she said, doctor, you really helped me. She was telling her sister that, no, this is the doctor that I was telling you about. And I realized that people just need someone to reassure them, someone to say,
teach them.
Yes, it's normal. You have to do it this way. And if they do it wrong, they call you and say, okay, am I doing it right now? Do I have to change something? And when they come back and they say, I've improved, my child is well,
my mental health is better.
It's so fulfilling. And for someone like me who likes women's health and all those things, when I see women being pressured into, you have to breastfeed. And sometimes it's not possible. For myself, I wanted to breastfeed my child for like 6 months, right? I told myself I have 6 months to exclusively breastfeed. But then I was working in obstetrics in a very busy hospital. When I went back after maternity leave, it was after 4 months. I went back. When I went back, I tried expressing. I had a mini cooler. It was hot. I tried. I tried. I couldn't. And then this one time, the milk spoiled. I was lucky. I'm going to need to put on the hospital fridge, right? But then I'm like, I don't trust these people. If they open, and I don't trust them. So that discouraged me, and my milk supply went down significantly. And another thing is that I didn't like the fact that you'll be so full, get wet, and it's not nice. You don't feel like yourself. So I was like, okay, I spoke to the dad and I said, my friend, we need to start buying milk now because I cannot do it anymore. It's not possible. And I told my granny, she's like, no, it's fine. You did your part for that few months that you could. Now you have to go back to work. And I feel like when I speak to my other friends, and she said, my friend was like, no, I am breastfeeding exclusively. I felt like, I'm a big mom. What I can't do it. My friends are doing it and they're working. And I forgot that my friend works in a clinic.
It's
different.
And
yes, and she can do it. She can go and hide somewhere, right? And then I was like, whatever. Sure. As long as my child is well fed and it's okay, I'm gonna leave it here. And I did my part, guys. Even God saw me. You saw me. I was here.
The same thing happened with me. So I mentioned that I had my first in med school.
Yes.
And then initially when she was born, it was during the COVID times. I was lucky. So I was at home studying from home. So I managed to breastfeed her for 4 months.
Yes.
But then after the 4 months, I had to go back to the hospital. Yes. And then that's when I realized that the time that it takes for me to pump milk is taking a toll on me.
Yes.
Because I'm already exhausted. I'm doing calls. I'm studying.
Sleepless
I have a baby, sleepless nights. Yes. But I'm so glad that I managed to accept that this was the situation. Like you mentioned, I tried my best, but this is the time now where
I have to stop.
Yes, I have to let it go. So I feel like it would be so nice if this was the message that we are spreading to all moms. Breast milk is great, but if you can't do it, if it's affecting your mental health, it's affecting the mom that you are to your baby, then it's not worth it.
Because imagine you have a problem with the fact that it's inconveniencing you, right? And then another problem is that now, because you're stressed about it, you're
not producing.
Yes, the milk is not coming, so you're double stressed. Rather, just buy the milk.
Yes.
And also, the South Africa has a standard. No formula. It's greater than the other, number one. And also no formula is closer to breast milk. Breast milk can never be copied, right? So you can never have a formula that has all the antibodies and no formula can do that. Whether the other brand and the other brand, all of them, they are the same. Whether the other one costs 500 rand, the other one is 200 rand, it's standardized. So with I'm happy that we discussed that. And I'm sure other moms, I feel like, hi, if Dr. Julia said, then push up, let's leave it here, you know. So how did you deliver? Because I think a lot of people are like, oh, you did scissor. You're not a woman enough. My sister, do you know 7 layers of your tummy
being cut? It's not an easy thing.
It's not an easy thing.
Yes.
Did you choose? What mode did you choose? And if you even had to choose?
So with my babies, the first one I delivered, I tried first. Then I was induced. Then it failed. I had to get a Caesar. So that's also the other very important reason that people get Caesars. Some people don't just choose to have a Caesar. But even if you chose to have a Caesar, it's still okay. But yeah, so I gave birth to my first daughter in a public hospital. And we all know you don't choose there.
It's not a choice,
one way.
Yes.
Yes. But then my baby was post-dates.
Okay.
So then I had to be induced. So I went through it all, the pains. There was a point when I just wanted to go home.
Because of the pain.
I took off the belt.
And it's not the belt that's causing you pain, my friend.
But I'm like, this belt, took it off, put it back on. Took it off, put it back on. But yeah, I was in labor, I think, for more than 12 hours straight. And I wasn't dilating. I think I dilated like 4 centimeters or so.
Oh, yeah.
So then that's when I started having fetal distress, coupling contractions. Yeah. So now it was a risk to the baby. Then we did an emergency Caesar. To tell you that emergency Caesar saved me from the pain, that I was going through. I was like, yeah, that's spinal.
Yeah, it resolved all my problems. Yes.
Yeah, so that's how my first birth experience went. Then the second time, obviously, if you gave birth via Caesar, it's safer to go back and do a Caesar again to avoid all the
complications of going back vaginally.
But either way, I would still go straight to Caesar. I think I've seen a lot in the public hospitals working as a doctor. Yes. And I just vowed to myself that I'm too traumatized to go through this. I'm not doing a VBAC. I'm going straight to a Caesar, and I don't even feel guilty. I don't feel a thing. I'm happy I have my healthy baby. And I'm healthy. I didn't have to jeopardize myself to prove that I'm a woman.
You're a woman enough. Yeah.
Yes, no.
Yeah. So with regards to going back to deliver vaginally after a Caesar, right? It can be done. And it should be done under a strict monitoring. So certain institutions like other hospitals are not meant for that, because you need to be in a hospital that has continuous monitoring, which in South Africa, we don't actually have that because we are poor, we're not well-staffed. You need to have a nurse that's here seeing all the contractions, seeing all the baby's heartbeat and reaction to the contractions, right? You need to be in an institution where there is a blood bank. Where I used to work, a lot of women would come and they'll say, no, I want to push back. And I'm like, on this call, there's only one doctor. And there's 3 nurses who have to
run.
One
theater open.
Yes, one theater open. If we're doing a Caesar now and you have your uterus
what's
ruptures,
going to happen?
Yes, we won't be able to help you because you need to go straight into operation. We also don't have specialists who will be able to come and fix your uterus. We'll go and just chop it out, you know, because we want to save your life and the baby's life, right? So when you make that decision, be well informed. If they need to, you really, really want to do that, ask them to refer you to an appropriate hospital to deliver there. Because when I was working in Ideville, we used to send them to Charlotte Matleke, and that was the safest way of doing it, right? Yeah, but you can choose whatever you want to do, girl. You can do vaginal delivery. Doesn't mean that when
safely.
Yes, because the thing is, if you work in a tavern and you've seen how many people get in trouble for drinking alcohol and whatever happens. I worked in obstetrics, right? I saw a lot of complications that you might not even see through the vaginal delivery, meaning that I'm getting traumatized as a woman.
Yes.
So when I see that, because of fear. But with all that being said, Dr. Julia, thank you for coming to the pod. Thank you for joining me on the Doctor's Corner podcast. Michael, thank you. I'm glad that I had you here and we had to speak about all these things. Somewhere, another junior doctor is like, where do I go? They can access you, right? So I want you to tell them, where can they get Dr. Julia if they don't know you already? And the patients that want to consult with you telephonically, how do they get you, and what platforms do you use to do telemedicine?
Okay. So if you want to get hold of me, I'm on TikTok, I'm on Instagram. I'm still trying to get back to YouTube, but always on Instagram and TikTok. And it's at Dr. Julia Sakman as a one word. And there's my contacts to my WhatsApp on my bios, both on TikTok and on Instagram. For my consultations, if you want to book a consultation with me, you can send me a WhatsApp on 076 700 6773.
Say it again.
076 700 6773. Then I can book you a consult. I'm currently doing my consult via WhatsApp video calls or Google Meet calls. So yeah, if you contact me on WhatsApp, then I can book your consultation.
And Rahupela, guys, go and consult.
It's only consulting.
Please go and consult. Don't just ask for advice for free. Not these days,
Not for free.
Not for free anymore. Now I'm well equipped with information, telemedicine. Okay, thank you, Dr. Julia. I think I'm saying this for the millionth time, but I'm really grateful that you were here. I feel educated, and someone else out there feel educated. And thank you for being here. And signing out, it's your girl, your village girl, Dr. Dakalo, Ndouvhada. And this was the Doctor's Corner. And thank you. Subscribe, like, and comment, and I'll see you on the next episode.